The FDA is changing how it gets outside expertise on food and medical products. Here's what that means. Caleb Alexander, who is a practicing internist and drug safety expert at the Johns Hopkins Bloomberg School of Public Health, joined the Public Health on Call podcast to break down the differences between FDA advisory committees and expert panels. In 1972, Congress passed the Federal Advisory Committee Act to establish operating principles and expectations for any advisory committees operating within the executive branch.
The act stipulates that federal agencies need to fulfill filing notice in the Federal Register so that the general public is informed with appropriate advance notice that a committee is to be held, providing formal transcripts that are publicly released regarding the proceedings that were discussed, instituting standardized but thorough conflict of interest reviews.
The FDA has used advisory committees to gain insights from physicians and biostatisticians and patient advocates on new products before they hit the market or when new evidence has emerged. These new expert panels look really different because they don't have to follow the guidelines set out by the Federal Advisory Committee Act that were created to ensure that Congress and the public were adequately informed. Instead, these panels operate without public transcripts, and they don't vet participants for conflicts of interest.
I think the risk that the FDA faces in switching from a model where advisory committees are used to where expert panels are used is that the FDA will lose the accountability that comes with the advisory committee framework.